My goal is really to have one surgery and to not have problems and to be predictable. Trying to rush this process is not really what we're after. We want to make it an efficient process, but we do not want to cut corners. So for example, patients who are wanting this to all be done in 24 hours and to have a permanent zirconia bridge within 24 hours, I would just say, okay, well, did you build your house in 24 hours, right? There are ways that you can get a house built in 24 hours. It's a prefabricated house. There's very limited options. It's a pretty basic structure. At the end of the day, I would just say, is that really what you want? Compared to something that we can try in, compared to something that we can actually build on top of healed gums, because every patient knows when you have surgery, you have swelling and the gum tissue changes. You can just ask any denture patient when they got their teeth out and they got their dentures in, how did those dentures fit 2 months later? Every single one of those patients comes back, needs relines or new dentures remade. Essentially a gold standard of our denture workflow, how we treat patients who are just getting teeth out and dentures. Every single one of those patients gets new dentures made at 4 months. That's been the case for 100 years. So why now does that change just because we're getting implants? Well, I'll tell you it doesn't. And one of the questions that all patients need to ask if they're going to get a 24-hour implant bridge, what is VOCO? What is Gradia? What is composite reline material? I would encourage the patient to do some studies on plaque adherence to composite alongside the gingiva. It is a lot more porous. You will have bacterial adhesion, and that then begins to start the plaque accumulation process. Why did about half of our patients wind up needing all-on-4s or permanent implant teeth? 40 to 50% of them have significant periodontal disease. So they are already at risk of having periodontal disease. So if they have to get their 24-hour zirconia bridge relined at 3 to 4 months with a composite material, then guess what? You are back to all of the risk factors that you had, and you are going to start that bacterial accumulation process underneath your implant bridge.